So hi. So today, I want to talk about hormones, and I want to actually talk about the transitioning process in the UK and how you actually medically transition from as a MTF trans woman. So basically that's what I want to talk about today. So so basically, where do I start? First of all, what you do is if you're feeling, if you have feelings of gender dysphoria, first thing that you should do is contact a counsellor and to try and explore these feelings and try arranging my hair. You should contact a counsellor first. I mean, people can feel these feelings of gender dysphoria for years, often decades, without kind of doing anything to alleviate them. People just try and suppress them. But from my experience, they never go away. You know, it kind of catches up with you. And personally, I my only regret with transition is that I didn't transition sooner. So yeah, because I mean, once you have puberty, you're you know, a lot of the changes that happen in puberty you can't undo. Hormones won't undo those, or even surgery. I mean, like for instance, you know, I mean, I'm quite self-conscious about how broad I am here, for instance, and how big my hands are. So yeah. So anyway, without further ado, as they say on YouTube, I I'm going to start. Oh, what's happening to my hair? So I'm going to start right at the beginning. So you go and see a counsellor, and it gradually becomes apparent. That counsellor will help you to clear up in your mind whether or not you do have gender dysphoria, or whether there's some other issue causing your mental state, your distressed mental state. So yeah, so you go and see a counsellor, and preferably a specialist counsellor. If you can't see a specialist counsellor, well then do go and see a counsellor first of all. And then the next step then is to go and see your GP, who will then refer you to a psychiatrist. And that, before I continue, there are plenty, this is the UK, and there are plenty of psychiatrists involved in the transition path in the UK, in the NHS transition path. So yeah, you see another psychiatrist, so your GP will refer you to the local mental health team. And in my case, I went to see my GP, I think it was about sort of maybe like February, and this is a couple of years ago. And then by May, I had an appointment with a psychiatrist who interviewed me while a nurse took notes. And the psychiatrist asked me all sorts of questions about how long I felt this way, and you know, what kind of you know, do I dress as female? Do I kind of you know, have I changed my name by deed poll, etc., and that kind of stuff. And they basically asked me, you know, about basically my life. It's like a life interview, really. And then if the psychiatrist is satisfied that you meet the criteria for somebody who has genuine gender dysphoria, they will wait for it, refer you to another psychiatrist, who is the local psychiatrist who decides whether or not to refer people with gender dysphoria onto the gender identity clinic. So you wait another couple of months. I mean, in my case, I had my interview with the psychiatrist at the local mental health team in April or May, and then I eventually got to see the NHS gatekeeper, what we call a gatekeeper, who decides, you know, whether to refer you or not to the gender identity clinic. I finally got to see her in November of that year, so it is quite a while. So this is almost a whole year now before you even get referred to a second psychiatrist for a second opinion, and to the actual, so that they can refer you on to the gender identity clinic. So the second psychiatrist, she asked pretty much the same questions, and that particular psychiatrist to know that somebody had changed their name by deed poll. So in between time, I changed my name by deed poll. I was already identifying as female. I was already living, presenting as female at work, and I changed my name. And, then that was the next that was mainly the catalyst for me changing my name, and also the fact that I was starting to look, so feminine, that when people, for instance, if I was in a doctor's waiting room and somebody saw me, they would, and they called out my male name, everybody kind of look at me and stuff, and do a double take. So yeah, so that was in November, and so she referred me to the gender identity clinic, which at the time was London, and this shows how long it actually takes to get your first appointment at the gender identity clinic in the UK, because she referred me in November 2016, and I actually had my first appointment at the gender identity clinic in December 2019. So that's a while. That's about 3 years. So the normal waiting list time for all the gender identity clinics are 3 years. So, which is pretty bad, really, because the NHS guidelines say that if you're diagnosed with an issue, the average waiting time you should wait is 18 weeks. So yeah, but anyway, it's because of the amount of people who are coming out as trans now, which is great, but the gender identity clinics can't cope. So yeah. The main thing, I wanted access to hormones, and you can't really get access to hormones in the UK unless you are prescribed them by a doctor, so you can't really buy them off the internet without a prescription. I mean, some people do. I don't know how they manage to actually get around that not having a prescription, but it is a bit of a gamble, because some of the stuff on the internet, some of the hormones, they either don't work or they're actually quite harmful to you. So it is important, if you can, to try and go down the route of actually seeing a doctor first. And it's also very important to get your blood tests as well regularly. So yeah, so I had to wait 3 years to actually even get my first appointment at the gender identity clinic. And in between time, the funny thing is that the Welsh Gender Identity Clinic opened in Cardiff in 2019, I think it was like autumn 2019. And in between time, so all the patients who had been referred initially to London, a lot of them were repatriated then to Cardiff, unless they wanted surgery. You still have to go up to London if you specifically want surgery. So yeah, we were all kind of repatriated. And then the gatekeeper whom I saw in November 2016, who actually referred me to the gender identity clinic, she was actually the same person who interviewed me at the gender identity clinic, because in the meantime she had retired, and then she actually she kind of went back to work for the gender identity clinic. So yeah, so that was quite interesting. So I had 2 interviews, and she remembered me, and she's very nice lady. And so what happened then was she referred me to the endocrinologist, and who prescribed me hormones, and I've been on hormones for about just over a year now. So that's great. But yeah, what to do once you have been referred to the gender identity clinic, but you have a 3-year-long wait until anything happens. So Right, well, what most of us do is try and get bridging hormones. Now, really, I think you're entitled to bridging hormones, but you won't always get them through the NHS. It depends on what your local health board says. Because in the UK, for people who are watching this from outside of the UK, the NHS system, all the different kind of counties and regions of the UK have different health boards that deal with you know, like budgets and stuff like that and all that kind of stuff. So yeah, so they're all organised into different health boards, and so it depends what the health board decides, you know, and what their kind of way of doing things is. But first step, you go to your GP and you say, I've got a 3-year long waiting list for the gender identity clinic. I need bridging hormones. I really need bridging hormones. So what they will do is they'll either refer you to an endocrinologist within your local health department. So you go to your local hospital and the endocrinologist will prescribe you hormones, hopefully. Or if they don't, I mean, they might turn around and say, oh, well, you'll have to wait for your first appointment at the gender identity clinic in 3 years' time. Then what you do then is you have to go privately, unfortunately, if you can afford it. If you can't afford it, this is what's awful about the system. If you can't afford it, well, you just have to wait. Yeah, so there are literally only 2 private companies, or 2 private doctors in the UK, I should say, who will prescribe you hormones, and that is Dr. Webberley's clinic, Gender GP, and there's another one called Gender Care. I believe they're both actually kind of run through online, through internet websites, so you don't actually go and see somebody. But what happens is you get a telephone interview, again, from a psychiatrist to decide that whether or not you have genuine gender identity disorder. And if, you know, I don't think we say gender identity disorder now, actually, that's kind of like, I shouldn't say that because that's kind of offensive. I should say gender dysphoria, because there's nothing really disordered about us. We're born this way, so I mean, there's nothing wrong with us. We just need kind of help, you know, to sometimes. Not all of us need help, but sometimes some of us want help, you know, to develop, you know, our, you know, how we feel more, if that makes sense. Yeah, so you go on to, you know, you can access both of these private doctors through the internet. The one, Dr. Webberley, has come under a lot of controversy and sort of, you know, on hate from a lot of TERFs and people like that. And for various reasons, I think she was struck off at one stage, so there was like a hate campaign against her. And, you know, there's people who don't, you know, disagree, you know, with kind of like having to go to a private doctor. But anyway, you know, I mean, if the NHS won't prescribe you hormones, then that's the only choice you have. And, you know, if you don't have enough money, you don't have any choice. You just have to wait the 3 years, which is absolutely terrible, I think, you know, and puts your life at risk as well, because if you've got to present as 2 years to actually even, you know, 2 years in your kind of the gender that you are to you know, to actually, you know, your target gender, I'm saying, so not the gender you sign at birth, but the gender you are. You have to wait 2 years for that, and if you haven't got hormones, then you're not feminizing and you're not masculinizing, and that's when you're at even more risk of being being attacked, you know, because there are still some people, you know, if they read you as trans, they will attack you and or kick you out of women's loos or men's loos, stuff like that, you know. So yeah, anyway, so yeah, the private clinics, they will prescribe you an anti-androgen, and they will prescribe you estrogen if they decided that you know, it's okay for you to have them. You will have to have a blood test first to show that your liver and kidney functions, your blood sugar, etc., your like cholesterol is all okay, and you know it can withstand the effects of the hormones. So once they've done that, they'll prescribe you, as I've said, estrogen and anti-androgen. And your anti-androgen will usually be something like either spironolactone or finasteride. You won't get, as far as I know, you won't get prescribed an injection, like, because the injections are more effective as anti-androgens. The injections are Zoladex, Decapeptyl, and there's also one called Prostap now, which I think has only just started to be used in the UK. But I'm on Zoladex. But those injections, they will get you need an anti-androgen to lower your testosterone level, you know, to as low as possible. Mine is at 0.4 and has been for like ages. And that will enable the estrogen to work then. Because if you've got testosterone blocking that, then the estrogen won't work, and so you won't become feminized. Yeah, so you will get that. So, and then you will have to kind of pay for your medications then. I think it's usually about maybe 70 quid a month, because you pay the prescription charge to Dr. Webley or Gender Care, you know, or whoever for, you know, and then you actually sort of pay the price of the pills then, which you actually order yourself on one of the kind of chemist websites, you know, online chemists, and they get sent out to your address then. So, you know, yeah, and then you go on like that for 3 years until you actually get your first appointment at the gender clinic, and then they decide then that whether or not the NHS is going to pay for your hormones. So, yeah. So basically, as I've said, you know, like most people do that. Most trans people, like, inverted commas, self-medicate at some stage. In the UK, there is no way of getting hormones otherwise, you know. And you should have regular blood tests as well. With the pills, I'll get on to the different types of hormones, sort of like the way that different types of hormones, but the way I'll get on to the different ways that the hormones can be administered. We've discussed pills, first of all, like spironolactone, or Spiro as we call it, and also finasteride, which actually is not very good in my opinion as an anti-androgen, because that won't lower your testosterone very much, really. Cis men use finasteride to actually, you know, especially particularly if they had a hair transplant, if they're afraid of going, if they don't like going bald, then, you know, finasteride is prescribed to cisgender men who, you know, want to keep their hair. So, as you can imagine, finasteride hardly does anything really to suppress your testosterone. So, once you get on to being prescribed by the NHS, so if you're lucky enough for your local NHS to say, okay, we'll give you bridging hormones right from the start, you will be prescribed an injection for your anti-androgen, for your testosterone blocker. You know, that's the same thing, the anti-androgen testosterone blocker, the same thing, T blocker, puberty blockers, you hear, like, they're all kinds of different kind of terms for them. So yeah, basically T blocker will be either an injection. Now I have Zoladex, and mine lasts me 3 months. So most of them, there's usually like a 1 month one, a 3 month one, and most people are on 3 month ones. And what that means is your testosterone is suppressed for 12 weeks, 3 months, and you will get an injection every 3 months. My GP surgery administers that to me. Sometimes, in some people's cases, it's a local hospital. But they, in my case, the injection, Zoladex is injected into my belly. It's quite painful because it's a pellet, but the pain doesn't last more than a second or so. So I'm fine with that, you know. I just take it, I just grit my teeth, and the nurse always apologizes because she knows that it hurts people. And there's actually another trans person who gets that jab as well locally. And then the other type of anti-androgen injection is Decapeptyl, and they inject you in your derriere, in your bum, so your bottom. So that's that one. Apparently that's less painful to be injected in your bottom than Zoladex in your belly, and I think Prostap's the same thing. That gets injected into your bottom. So yeah, so I drew the short straw, but I don't mind really because Zoladex is okay. They're quite expensive actually. They cost around 230 quid, you know, for like 3 months supply. So it's fairly expensive. And onto your estrogen. So the type of estrogen you'll be prescribed will come in maybe 3 different forms. I don't know when there might be other forms, but there are 3 different ways to actually get estrogen into your body. The first one, which a lot of younger trans people use, and people who don't have health conditions like me, is the pill form. So one of my friends is on pill form. A couple of my friends are having pills. So basically, you take the estrogen pills every day, and I forget what they're called, Proganova maybe. I'm trying to think of the other ones, but one of them is Proganova. And basically that's estrogen, and you take that once or twice a day. It depends which dose that your doctor has given you. It goes by like 2 meg, you know, 1 meg, 2 meg. A lot of people start off on a really low dose normally to see how your body copes with it. And so you take it in pill form. And then there are the patches, which a lot of trans women over 40 have, and a lot of trans women with health conditions as well will have patches, because the patches, the difference between the patches and the pills is that the patches will don't actually travel through your liver or your kidneys, and so they don't have to be, your body doesn't have to process them. The patches actually contain gel which actually sort of goes through your skin, so the estrogen actually sort of, you know, kind of like makes its way via your body through your skin, you know, so that's good. It completely bypasses all your kind of internal organs. So so there's the patches. There was a problem getting patches into the UK. I think it might have been a health and safety issue. So a lot of people who were on patches, because I was on patches because I have like this health condition, polycythemia vera, and I have, you know, kind of diabetes as well, and cholesterol problems. So they decided the patches would be the best way for me to go. So yeah, so they had to stop. They ran out of patches, so they actually put me on a thing, on the gel. So the gel is the third kind of method, and the gel comes in tubes like about that size, and you can either apply it to your shoulders, to your bare shoulders, or you can apply it to the inner thighs, and then you just kind of let it kind of absorb into your body then. And the important thing is not to, like, say, put a pair of tights on, you know, just after you've applied it, or to have a bath, or you have to wait until you have a bath. You have to wait until half an hour after you have a bath before you apply the gel. So yeah, and so that's basically it really. I mean, so if you're going down the surgery route, which I'm not going down the surgery route, you still have to go to London for your appointments. Now, obviously with COVID, a lot of that's changed now. So people are having Zoom appointments. Like my friend, she's having her 3rd appointment at the the London clinic next week, or actually no, it's January 12th. So she has to, hers is by Zoom now, and my last lot of appointments I've had with the Cardiff clinic have been over the telephone. So yeah, but with the London clinic, if you actually want surgery, there's still only one clinic in the UK, as far as I know, that you have to go through, and that is the London clinic, the Tavistock and Portman. So basically you go there. I've actually been there because I've actually been twice with my friend because she wanted me to come with her. She wanted another trans person to come with her. And I've actually been into her, appointment as well. So I've actually waited with her while she had her appointment. Basically, everybody talks about the clinic, and you think in your mind that it's a huge place, the London clinic. You think this must be massive, but when we got there, it was like a really tiny place, and you kind of press the intercom on the wall, and and then they kind of like let you in, and basically there's a small desk there, and there's like a waiting room which is really small, and there's room there probably for about 10 people waiting, and when we were in there were about 5 or 6 other trans people, so it's that small, and there were like 2 or 3 people behind the desk. There's kind of like information leaflets as well you can read, and then the doctor calls you, and you actually kind of walk up, you kind of walk upstairs. There's like a little windy staircase, and then like your first interview, you'll get another psychiatric assessment, and you have to give like your life story and everything, and then you get sometimes then that doctor at the gender clinic will actually ask your GP to prescribe you hormones, and you will get them then. And your second sort of, you don't really talk about surgery until your second appointment, and then you don't really get a signature to sign off for surgery until your third appointment. So that my friend is actually waiting, to get her sign off for surgery, and then hopefully she'll get a surgery date then for either next year or the year after. So yeah, the second appointment they explain surgery and explain as well what can go wrong, etc. as well. So they're really still trying to make sure you're committed to having surgery. So yeah, and yeah, so that's all I can think of really. I'm sure I've missed something out. But the important thing is, not to give up. It's difficult. It's really, really difficult, I mean, I had a lot of problems because my health conditions got in the way of my other health conditions. There was literally no medical literature for a trans woman with my health condition transitioning via hormones, to say whether or not it was okay for me to do that. So I had to go privately, almost to kind of like prove to the doctors that I could, I could take hormones and it wouldn't have an effect on my other condition. So yeah, so touch wood, the hormones have been fine, I mean, I haven't had any side effects, touch wood, I'm very superstitious. So please do ask me, I mean, I know a lot of you will know this stuff and you'll say, yeah, like whatever, we already know that, Katie. But, thank you for watching. But, please, if you have any questions, do ask me below, in the comments below. And, and I will try and answer them. And if you, have anything to add to this as well, if I've sort of given any inaccuracies here, please do let me know, because, I only know kind of like the path I take, and I'm not an expert. I don't explain things very well. So yeah. So, thank you everyone for watching, and if I don't make a video before Christmas, I'd like to wish you all a very Merry Christmas, Happy Holidays, whatever you celebrate, I hope you have a lovely time and you get a chance to, reflect and kind of, just take it easy and be kind to yourself, and it's been a very difficult year, I think, like, Christmas won't be the same this year, New Year's won't be the same. I know for all the other cultures, Eid wasn't the same, Hanukkah wasn't the same for, I mean, nothing is the same for anyone this year. It's a really weird year. but you know, don't give up, and you know, please, you know, if you have any messages, if you want to ask me anything, you know, if you want to tell me how you feel, please kind of let me know in the comments below. And thank you all for watching, and I love you all. So au revoir till next time. Bye.